I just woke up one day and my finger was doing like all this clicking and popping every time I tried to bend my finger. I had no grasp. I couldn't grab things. I had no strength in it. And it hurt. It hurt really bad. And over time, it kept getting worse. It wasn't clicking and popping anymore. It was locking. I am Cathy Holen. I had trigger release surgery for my right thumb today. Our family doctor, I tried calling him to see if I could get in, see if he could do anything, but due to COVID, they're only doing video calls or phone calls. So I couldn't get in to see him. My rheumatologist is doing the same thing. She's not seeing patients. She told me to go to urgent care. So I went to urgent care thinking they'd be able to give me an injection or something, and they said there was nothing they could do. I had to see a hand specialist. So I saw Dr. Hoekzema about 3 years ago for an issue with another finger. I've got rheumatoid arthritis. I was having problems with the joint, so I saw him. So once I got done at urgent care, I decided Monday I was going to call his office and explain what was going on, and they got me in that same week. When I called to make my very first appointment when I was having problems with my other finger, or even this time, I hadn't seen him in 2 years. I didn't know if I'd need to get a referral, and I told the girl at the front desk what was going on. She got through to Dr. Hoekzema's office, and they said make her an appointment. So they got me in right away. There was no waiting. There's always been great follow-up. They'll call, I think it's usually the day before the appointment or 2 days before to remind me that I've got an appointment coming up. And if I've ever had to cancel anything, they've always been great. Well, at that point, they diagnosed me with trigger thumb. And I was at the point where my finger was locked for like 3 days, bent. I couldn't straighten it out. So when I got here, they gave me the injections saying, hopefully, the injections will do the trick. I came back to see him in 3 weeks and my finger was still locked. That was when he said, if the injections don't work this time, you're probably headed for surgery. You could either come into the office and just have it numbed and be awake for it, or you can go to the hospital and they can sedate you. I was surprised. It was very painless. I didn't feel a thing. I felt a little bit of the pressure, but I didn't feel any pain whatsoever. It should be back to normal, and I should be able to do things. I love to cook, I love to bake. Kind of hard to go shopping when you can't grab things, so it's going to be important for me.